the heart of Kenya, where vibrant cultures and breathtaking landscapes meet, a transformative journey is underway to combat the silent crisis of gender-based violence. The Kenya-Finland Bilateral program is working hand in hand with local governments and communities to strengthen systems, improve services, and address the root causes of risk and vulnerability. Join us as we explore remarkable stories of change, resilience, and the promise of a brighter tomorrow. Before the implementation of this program, statistics were alarming.
Before we had the exposure to the knowledge, GBV cases were rampant. We didn't know even how to refer. So in most cases, some of them, we just used to listen to them and let them go without even justice done to the people.
One of the challenges that was in Samburu before the program came in Samburu is that we didn't have counselors. We only had maybe one counselor at the referral hospital.
The Kenya Demographic and Health Surveys for 2022, Bungoma was #1 in physical violence at 62%. We also had a high percentage in sexual violence at 30%, which was one of the highest counties in the country.
Utagundua kwamba masuala ya dhulma za kijinsia kwingineko hata haiwezi kuwa inaeleweka ama kukubalika kwamba ni dhulma kwa sababu ya nyenzo ama kwa sababu ya systems, cultural systems, traditional systems ambazo zimebobea katika hali ya kumpatia mwanamume kipaumbele na kumpa kwamba aonekane kwamba yeye yu mbele na yu juu ya mwanamke.
Thanks to the collaborative efforts of the Kenya-Finland Bilateral program, comprehensive training sessions were introduced across various sectors, including health, education, people living with disabilities, children's department, police officers, border riders, community-based organizations, and law enforcement. These sessions have equipped participants with the skills needed to identify and combat GBV effectively.
The purpose of this particular program was to identify the preventive and responsive measures towards GBV in a bid to end all forms of violence against women and girls in this particular country.
The main goal of the program is to contribute to the Kenyan vision of eliminating FGM by 2024 and ending GBV. We also support them to improve coordination by ensuring they share information across the sectors, and also support them to ensure that there is a sustainable and quality service delivery to the survivors of GBV.
This program has enhanced the capacity of both legal and moral duty bearers through training such as psychosocial counseling, alcohol, drug and substance abuse counseling, mediation courses, leadership and coaching, community policing, among others.
Two things that are very unique in this particular program. One is the seasonal calendar, looking at what is the time that the GBV cases are most prevalent in this particular county. Then the second one is to look at which areas have the highest number of GBV cases.
Remarkably, the program has led to significant improvements in community awareness and response and strengthened systems in handling gender-based violence cases.
The number of officers that have received such a training are very useful to the station, because these issues are not only faced from the society, but they are also experienced amidst the officers.
We were able to reintegrate 56 girls back to the community, and we were able also to rescue 4 girls that are currently in Machakos Rescue Center. So among these 56 cases that were successfully reintegrated, it has actually been a very serious gap in us. And that's why I applaud it as a big success to us, because initially we've not been doing it.
As an office, we can say that we've already made the gender sector working group more effective through the training, and therefore it is a plus for Samburu County. After the program came in Samburu, so many councillors have been trained. We have over 750 councillors who've been trained, drawn from all the 3 sub-counties of Samburu County.
Tunaongea juu ya madawa ya kulevya.
Uzuri ambao tumepata ni kwamba kupitia kwa ile ujuzi niliyopata kwa Kenya Finland program, nimepata kutrain vijana ambao walikuwa kwa uraibu wao, kwa sababu wanajulikana na wenzao, ndio wanawafikia kwa urahisi na kuwaleta, na tunawapatia nafasi ya kuwaongelesha.
I'm also one of the beneficiaries, having been trained on counseling psychology, and it has really helped me individually in terms of provision of my services. Nowadays, I'm able to engage the youths in a different perspective.
We're grateful because of the Kenya-Finland Bilateral program on GBV psychology and counseling sessions. At least the numbers currently are manageable and very low. I can report a good number of matters having been convicted before court, and even on how the matters are handled currently is at pace that we can also have that collaboration with the members of public.
A pivotal moment in the Kenya-Finland Bilateral program was the graduation ceremonies across the counties, graduating duty bearers with various certifications and bringing together community leaders, government officials, and other stakeholders to commit to a GBV-free society.
Graduation is not just a celebration of the end of this particular project, but a celebration of a beginning of better opportunities, better potential, better workforce in the county, because now with over 643 councillors out here in this particular county, all the survivors of gender-based violence have somebody close to them to listen to them. That is thanks to this particular Kenya-Finland Bilateral program that has brought in a cause that is very practical, is tangible and locally available to the people.
A robust sustainability plan has been established to ensure the impact of the program endures. This includes ongoing training for community leaders, continued engagement with local media, and integrating GBV awareness into school curricula.
In the Department of Health, we had only one councillor who used to juggle between the clinical work and the SGBV response. But currently we have 25 healthcare providers trained on counseling who are now responding in various ways, so that we are able to move them from one facility to the other when need be.
From where I am now, I feel more knowledgeable. I got more skills. I also got the capacity to do referrals well.
Cases in the community that went unreported, through the dialogues and chills to the barazas, they are now able to come for the services. Emergency services of PEP, pregnancy, trauma counseling, evidence collection.
In an effort to end FGM, the program has achieved a key milestone by having the Sabaot elders make a declaration committing to support the government in ending FGM and early marriages.
On behalf of Samburu County Referral Hospital, I want to thank the Kenya-Finland Bilateral Program for ensuring that our clients are receiving their services in the right manner. Thank you very much.
We are happy as a program to look back in the 2 years and say, indeed, it has been impactful and there's so much that can be done. More partners can come on board and to ensure that they can pick from these particular lessons and make it even longer.
Through the collective efforts of individuals and organizations, the Kenya-Finland Bilateral program is paving the way for a future free from violence and discrimination. The journey is ongoing, but together we are building a safer, more equitable Kenya. The Kenya-Finland Bilateral program is not just about numbers. It's about lives transformed, communities empowered, and a brighter future for all.
The program has made a major contribution to Kenya's vision of eliminating gender-based violence, including female genital mutilation and other harmful practices by the year 2026. The unique feature about this program was the introduction of targeted interventions and the localization strategy. The interventions were local-centered as communities took lead in the implementation process. We are engaging with county departments to have all trained duty bearers placed in relevant departments so that they can practice. And in fact, we have also developed service directories of all those we trained, and they have gone up to the ward level. So this skill has been cascaded to the local level at the ward level. We are fast-tracking development of the roadmaps on the implementation of the Sabaot Declaration, and that's sustainability.
Kutembere hamwenga.
Twendere alala. Mairia mari tonopo.
Tutembee pamoja.
Tutarire amo.
Tutembee pamoja.
Mairia mari tonopo.
Kukendela alala.
Kebeshet kubagenge.